Welcome everyone. Welcome to today's webinar hosted by Kommunicate. My name is Manav Borua. I work as a product marketing manager here. Kommunicate is an AI-powered automation platform for customer service. It helps businesses drive excellent customer service with its stack of AI-powered solutions. Today, we have a very special guest with us with a strong background in ChatGPT and healthcare. I would like to introduce you to Harvey Castro. Harvey is a thought leader and a strong advocate of AI. He has published many books on ChatGPT and how to use this new technology in healthcare. But before I begin, I want to set some context of the purpose of this webinar. What we have seen is with all these new technologies coming in, all the other industries have already used it. They're already using it. But healthcare is a very complex industry. One cannot simply start deploying this new technology without it being tested. Every new product or technology that comes into healthcare has to be approved by the governing bodies of the specific countries. If not regularized, it might affect the patient in the wrong way. Especially now with large language models and generative AI coming in and taking over the industry, healthcare professionals are very eager and they want to understand how to best use ChatGPT to drive superior patient experience, what are its limitations, and how to use it effectively and ethically. So without any further ado, I would like to introduce you all to Harvey Castro. Harvey, please take over the session, and please tell us a bit about yourself and what do you think about this whole new ChatGPT revolution in healthcare?
Awesome. When you get a chance, if you can add the share button, and then my thoughts real quickly about me. I'm a ER doctor. I've been blessed in that I've been a doctor for over 20 years. Believe it or not, I've been kind of like the mad scientist. I've done a little bit of everything. I've started iPhone apps. I did over 30 on my own. I've actually had my own billing company, my own staffing company. I started 8 emergency rooms with my own brand. So I've done a lot in healthcare, both in the trenches and in the C-suite. But I want to share a quick story, and then I'll start my presentation. But basically, sorry, I'm just getting it here. I'm going to start the presentation and then talk to everybody. So basically, how did I get into all of this? It honestly has to do with the iPhone. I was playing with the iPhone. It was the iPhone 1. And I was in the emergency room. I had a patient that was coding, and I had to tell the nurse, hey, we need to start this IV and we have to start it right away. Back then, it was common to have a textbook, and she got a textbook out, started thumbing through it and said, okay, here's the dose. And the patient's literally dying, and we're doing CPR and everything. And I thought, man, we need to do this quicker. And so I developed an app called IV Meds. And long story short, it was just 3 clicks and it got you to the dose and it verified and all that good stuff. And it went in the top 10 medical apps in the whole world. And from that, I started just creating more and more apps. Fast forward, I'm starting playing with ChatGPT in November of last year. And I thought, holy cow, it gave me that moment of the iPhone that I thought, this is going to change healthcare. This is going to do things differently. So I literally started writing books. My wife thought I was crazy because she's like, what is ChatGPT? Don't know what you're doing. I have no idea. Just know that nobody's going to read your book because nobody knows what ChatGPT is. And so I actually held the book for a while. And then I said, you know what, forget it. December 5th rolled around and I was like, I'm publishing it, and it came out. Since then, I have over 10 books on AI and healthcare. And there's a combination of just crazy stuff like I did some AI and crime solving and started my own different kind of crazy stuff that I've done. But I'll go into it. But let's jump into the conversation. So, these are 2 books. One, I'm not trying to push these books, but they're all on Amazon. The first one here that I'm showing you is Bing Copilot. The skinny is just going over other GPTs, not just ChatGPT. I talk about Claude and other LLMs that are out there that are going to help change healthcare. The other book that I have here is called Revolutionizing Healthcare, the fitness one. Basically, it's when I wrote this came out in March. But my goal was telling patients how to use this, how to do it safely, and how to work with your doctors. And that was my main goal. And I thought, people are trying to get fit, people are trying to lose weight. Let me put that spin on it. And so going to the next slide. So let's talk about ChatGPT. What everybody hears about it, but did you know that it's in the 99th percentile of IQ Basically, according to Scientific America, back on March 28th, they released this article and it said that, which is kind of crazy. Everybody knows that this is, catching a fad and everybody's talking about it. But what's interesting is it did so well that even though they may be playing with a different type of AI or maybe a different brand, everybody still calls it ChatGPT, but they may not be playing with ChatGPT. They may actually be using Claude or another AI. And so big picture is I always worry about this algorithm because at the end of the day, this has what's called reinforced learning from humans. And that's what makes ChatGPT so special. But you're going to laugh when I say it was reinforced by the wrong humans if you want to use it in healthcare, meaning if you want to use it in healthcare, we need to have more training on this LLM. Maybe it's ChatGPT 7 or 8 that'll come out, or maybe we need a GPT that is trained by doctors, that has a database from doctors, PubMed, all the resources we use to do a really good job. And again, it needs to be reinforced from physicians, and not just any physicians. I'm an ER doctor and I should verify only ER medicine. I have no business in surgery and other specialties. In fact, I'll say it later, but one of the biggest things in healthcare is medical knowledge used to double. In the 1950s, over 50 years, it would double. So it would take 50 years for the amount of medical knowledge to double. Now, that same information that doubles, it only takes 30 days. In 30 days, my expectation of what I should know should double, which is it's crazy, it's unreal. And so we need tools to help us. And so this talk is about how to use GPT in healthcare. Well, here's the skinny. Pre-patient. I divide the talk with patients and doctors and then the visit. So before you see the doctor, to see the visit, and then after. Basically, before you see the doctor, I advocate, and I know doctors out there are going to hate me for saying this, but I advocate use ChatGPT to help you formulate the questions that you need to ask your doctor. You only get 13 minutes with your doctors. Why not make that the best 13 minutes? Why not ask your questions and formulate the questions? Often I see patients and they're shy. They don't know what to say. Whatever I say, they're like, yes, I got it, doctor, but they don't really get it. And so why not have the right questions? You know, you have diabetes, hypertension, you know, you're there for a physical, or you know, you're there for a cold or whatever it is. Why not formulate the questions, formulate the follow-up questions? That way, when you're there, you're prepared, you're going to make the most of your visit. Other things I've seen is why not during the visit, I know this sounds crazy, but why not use the visit together? Why not you and I'm your doctor, we pull up a computer, we talk, and I speak medical language. You're not a doctor. And so when I speak, I do my best to give my information as if I was talking to my kids or someone that doesn't have a background in medicine. But sometimes our brain is so hard to explain things. Why not open up the computer and say, you know what, you have this disease. Here's the issue. We're going to use ChatGPT to help me. What if you speak another language and you prefer if I spoke to you in another language? Why not use that ChatGPT to help me convert that information? Now, obviously, there's HIPAA, there's privacy laws, all that stuff, but put that aside for a second. This technology can be used towards that. But again, my earlier point was it's not 100% there for patients in the sense that it can hallucinate, and we'll go over that in a little bit. The other thing is what I call vetted information. So if you're seeing information coming from ChatGPT, everybody's like, oh, this is outdated. It's the year 2021. It's too old. It shouldn't be used. It hallucinates. Well, this is why I think it's so important that the doctor needs to vet the information. So whatever ChatGPT says, I need to look at it. And again, if it's in my specialty, it's in my wheelhouse, I should be able to say, yes, this is correct. Or you know what, this is wrong. Why not use that to create better discharge instructions? So I can say I have a website and I see diabetic patients. Why not create all the information using ChatGPT, the right words, the right audience, the right culture, and then make those discharge instructions using ChatGPT. So I'm speaking to that person, but not just to that person, but I'm speaking to that age group, and then take it to another level. Why not, if you're a diabetic and you're 5 years old, why should I talk to you any different than if you're 30 years with diabetes? So there's a different discharge instructions. And so why not accommodate that based on your culture, your age, your time in that disease, and your disease process? Right now, our discharge instructions are very cookie cutter and they're not that specific. So post-patient visit, again, we talked about this vetted information. We talked about better discharge instructions, and we already mentioned the 30-day double in medical knowledge. So one of the other things is all our resources, why not take it to the next level? We talk about AR, VR, XR. Why not use that in our training to help me as a doctor, get me better information? There's all these information through ChatGPT. I may be visual, I may be auditory, I may be both. Why not have ChatGPT make these great graphs with code interpreter? It can make graphs now. With the technology that's there, there's tons of companies that are working on visualization for this. But then using it for the patient, why not use this information to help our patients? So imagine seeing your doctor and being told you have a disease, and then you get some VR glasses and you're going through a video of the anatomy, explaining your pancreas, explaining what happens to your pancreas, why you need to take your medicine, what happens if you don't take your medicine. Like this whole thing, I really think if we had that time to use this technology and take it to the next level, our patients would live longer, would take our medicine, would probably live better. And I'm really excited about this kind of stuff. And so this is kind of one of my favorite slides. This hospital in England basically took discharge instructions that they give all the kids, and it was for a kid that was 5 years old, asthmatic. They took the information, fed it into ChatGPT and said, speak to me as if you were talking to a 5-year-old. But then they took Dolly and they put that text into Dolly and said, make me a coloring book to coincide with all the things that I need to teach the child. And instead of giving this child papers to be discharged, or the parents, because most 5-year-olds are not going to pay attention, why not give them a book? And give them that book of a coloring book. And then now the doctor, the nurse, the parents can sit down with the child, color with the child, work with the child. The child can understand their disease process and really take it to the next level. Now we're more likely to see them take their medicine. All right, so the bad. We got hallucinations. We talked about the year 2021. This thing's not trained in healthcare. I think it's going to take like a BioGPT or something again that's healthcare related. It's got some biases. Obviously, I'm here in the United States, but if you're in another part of the world, it may not apply to you. And we can go over all the reasons why it may not work, but it's going to have biases. Huge carbon footprint is another. Obviously, the ethics that's involved. The internet gap. If some parts of the world do not have internet, they may not be able to use this. And then I've always talked about this ethical issue. What if, they're saying ChatGPT is being subsidized. What if one day they turn around and say, no, it's not $20 a month. It's going to be $300 a month if you want to use this. What's going to happen? And what if I said earlier when I was saying, hey, if you use this technology and you're learning and you're living longer, why not use this information for the best of you? And so if all of a sudden you're living longer, you're getting better information, your lifestyle is better, but then now they change it and say, you know what, it's going to cost more. Now it's going to affect you. So there's ethical involvement here. Obviously, we talked about privacy. We've seen it in the news. We hear about the big Samsung issue where one of the workers put sensitive information into ChatGPT and it was all intellectual property. And then it unfortunately went to ChatGPT and they have that information. As a doctor, I got to say, I love foreign doctors. They're actually one of my favorite doctors because they don't over rely on technology. They really do a really good job listening to the heart, talking to the patient, getting a great history, great physical. And I call it over dependence on technology. And I'm worried personally that one of the bads is going to be this over dependence on AI, where doctors are going to start ordering stuff, but if the AI is saying, hey, this is my peripheral brain, say you need to do this, that they stop thinking. And it's that gestalt, it's that looking at the patient, looking at their eyes, their tone, looking at all those things, that it's going to make it another level. So I'm worried about this. And I talk about the unknown, which is obviously we don't know, but what's going to happen? I predict that we're going to start seeing some really cool stuff coming from GPT technology and uses of this. And it's not coming from the United States. It's not going to come from a first world country. I think it's going to come from a third world country. I think one of the countries out in Africa is going to look at this technology and say, you know what? Some of our population do not have healthcare. The risk outweigh any benefits. So let's create a ChatGPT to help change that. And now use this because we can help people in healthcare. We can use this tool and we can put it out in the middle of nowhere. And so I think that some of the things that we're going to start seeing are going to start coming from these nations. And then other countries like the United States that are looking at it and they have strong lobbyist group, people that don't want to see some of the changes are going to fight it. So it's going to be quite interesting to see. I'm not going to go into all the different examples, but basically using ChatGPT is going to change things. Excuse me, using multimodality. I'll do a quick example as an ER doctor. I unfortunately see patients that have overdosed. They obviously can't talk to me, don't tell me what's going on. And usually the ambulance comes in, I have an unconscious patient. The ambulance says, here are the pills, and they don't give me a bottle. It's just random pills. With ChatGPT and coming in the near future, I'll be able to take a picture of that pill. It'll analyze it. I'll be typing the type of patient it is, and then it'll say, oh, this is a Tylenol overdose. That'll be tied to my electronic medical record. It will tell the pharmacy will be able to pay, we'll be able to see and say, oh, Dr. Castro has a patient, she weighs 70 pounds or whatever. Here's the antidote, and we'll start shipping it. Right now, that would take a while for me to call poison control, work it out. But using this technology, it's going to cut the time and it's going to save lives. And so real quick, what kind of things can we see? Well, some companies are already using it for pre-authorization letters, summarizing discharge instructions, radiology reports. But you know what? I was thinking the other day and I was like, why not teach doctors how to be more empathetic, how to word things better, so use ChatGPT to help you do that. And I think that'll be a good use. The future is crazy. It's going to be fun. We've heard about Khan Academy having Conmigo, which is this little AI that helps you as a tutor. We've heard of Epic getting in bed with OpenAI and Microsoft, creating this amazing bridge, which I think is coming. Once that comes out, I think the API plugins and all that good stuff, other startup companies are going to see this and say, you know what, I can create XYZ because I see how they're doing it. I could do it, but I could do it cheaper. Mayo Clinic is actually using MedPalm 2 from Google. And then I love this one, NYU Tron. Basically, it's a hospital system in New York, and what they're using is all their data from inside the hospital. It's not ChatGPT, and they're creating their own large language model, and it's able to predict the hospitalization, readmissions, and health outcomes. I think that is the future. I think many hospital systems are going to start doing that. If you look in the news, this one is doing it. Mayo Clinic is doing something similar. So it's coming, Cleveland Clinic. And then with this API, sky's the limit. Another quick example, so we can jump into Q&As and some of the other stuff. I love this one, Instacart. Here in the United States, there's an app. I don't know if it's available all over the world, but the skinny is you can order any groceries and they deliver it to your door, which is kind of nice. But here's the thing. Let's pretend I'm using the diabetes example. Let's pretend I know my patient's not eating right and I know it's because of their food. Why not use ChatGPT plugin, say, hey, I need a meal plan Monday through Friday. This patient eats only 2 meals a day. And then the patient hates eggs, hates fruit. And by the way, they're allergic to peanuts. Give me a meal plan. So it makes the meal plan. But then I use the plugin to take the meal plan ingredients and put it into the Instacart. And now as a doctor, I'm working with the patient. Now it's on their cart and now they can check out and now it's in their home. Now I know for sure the food's coming through. Or I could use a nutritionist to do the same thing, which I think it's amazing. So what is the future? Is it BioGPT? Is it BARD? Is it MedPalm 2? There's this thing called Glass Health AI, which is promising. There's another one called Hippocratic AI. Or is it going to be an ER LLM or different specialties like we talked about? Or will it be your LLM? The future is interesting. I call it the AI wars. Will we have our next LLM in our phone? I think that's coming as well. I think this Apple GPT thing that we've heard about, or Exxon or whatever it's called, GPT from Apple. I think what's going to happen is the next iPhone in the future will have a higher grade in the sense that you'll pay extra. Maybe it'll be $2,000 and then it'll have more memory and it'll have a very small LLM, but it'll be the most common things. That way you don't need internet. And I think that's what they're going to be doing with their own. Obviously they have Siri, they have all these other plugins. Amazon's doing the same thing. They're pushing their products. So it's going to be interesting to see what happens. We know that Elon Musk has X, which is, they're calling it the Truth GPT. We've played with Claude AI. So it's pretty cool right now. I'm excited to see what happens. Next slide. Lastly, I've been playing with Code Interpreter from ChatGPT. I basically was playing around with it. I took my LinkedIn image and then I made a little video using Code Interpreter, and it was pretty interesting how fast it could do that. I think the future will be this multimodality. We're going to start having robots. We're going to pair it with ChatGPT. We're going to put wearables, basically everything you can think of. I think it's all going to merge and it's going to be into one. And we'll go into that later if you want. We can talk about that, which is kind of fun. But the skinny is using ChatGPT's multimodality, the video. If it sees somebody walking, it can say, you know what, the person's favoring the right. They're having hip problems. There's just so many things that's out there. This camera right here today, unfortunately, can say how old I am. There's algorithms that'll say what my blood pressure is and actually give you my hemoglobin A1C, glucose level. All that information is right there on that camera. If the person has that at home in their algorithm during this talk, they can get all that information about me, which if I don't want to share that I can't do anything about it because the technology is there. So the future, I believe, like I mentioned earlier, we are going to have augmented reality, artificial intelligence, and virtual reality all merge. And so I see a future where the discharge instruction might be a combination of AR created by AI, and now my discharge instructions are being made in real time, and then the doctor's vetting that information. And so big picture, if you want to follow me, I'm on social media. Just type in Harvey Castro, MD. I'm on LinkedIn, YouTube, all the major ones. This is kind of cool. I use Hugging Face to make these 2 QR codes. It's got a little picture on it and they actually work. But one of them takes you to my GPT podcast, which is actually kind of crazy. I clone my voice. I feed ChatGPT information. ChatGPT creates a fake conversation with my business partner and I, and then we upload it, and it literally is our podcast. So it's kind of cool. The other is just a link to all my books that I've written in the past. And then that's basically it. So let's jump in, and thanks again.
Thank you so much, Harvey. That was really, really interesting. Like there are many things which I heard for the first time. So these are really new for me too. One thing which is like very much into ChatGPT is the biasness, which you also spoke at the beginning of this session. Pardon my ignorance over here. So obviously we're not asking doctors to code, but this data has to come from somewhere. And that is where, what do you think about the privacy of this data? Obviously these data are from patients. Do we reach out to them? Do we tell them, hey, we are using your data to train our model? How do we do that? Like that's seriously, yeah.
So I've seen it happening a couple of ways. Let's use the New York example. Patients already signed, unfortunately or fortunately, they already signed away their rights. They said, okay, this data can be used for hospital purposes, for research, whatnot. So they have the information. So let's say someone like you went to the hospital and said, let's create your own LLM. And there's different, obviously on the tech side, there's different ways of doing that. And then now the main thing is not going to the cloud, not going to ChatGPT, or it's a secure cloud. It's only staying intranet, and it's not going outside to the world. Other things I've seen is software that scrubs the data. So it's, in the United States, we call it 18 different identifiers. So you can use my address, my phone number, there's 18 different things. And so you scrub the data so that when ChatGPT sees it, they don't really see my name. They see Mr. Jones and different. And so they don't ever get that. And then the other thing I've seen that I mentioned earlier already was just having that in-house. That way it never goes out. So those are ways that I've seen it being done.
Got it. And since doctors are not coding, or either hospitals or medical schools, they hire coders, software developers, and build this new model based on the data that they have received. Do you think this is where exactly digital transformation organizations or IT or automation companies can come in and coordinate, work together with them? But obviously GPT is something a very higher level of coding.
Yeah, I think what the future will be, something is going to be like federated learning, where each hospital gets to have their own data and will submit the data to the cloud. And then every company, every hospital will have their own data and their own parameters specific to their own population. And that LLM will be treated towards that population. But then the nuggets or the things that are learning are going up, and then everybody's using it. And then simultaneously, all of the algorithms are being updated. So I think that is going to be the future. But you're right, there's large amounts of information. This is hard, like you said at the beginning. This is healthcare. It's not like, if the computer makes a mistake, no big deal. No, somebody can die, something bad can happen. So this is going to be interesting. I know the AMA has come out, the American Medical Association, and basically said, we don't want LLM being shoved down our throats, because what if something happens? At the end of the day, the doctor's responsible. It's not OpenAI, it's not the computer programmer, it's or the service or the cloud provider, it is the doctor. And so the American Medical Association is trying to make it where if something bad happens, it's not the doctor, it's going to be the software or OpenAI. So it's going to be interesting to see. I personally don't think that's going to happen until we see some jury or lawyer saying that the standard of care is this type of AI and it should have been used. And then at that point, you could maybe argue that, yeah, no, it wasn't the doctor, it was the algorithm, and prove that the algorithm made a mistake. But this is such a big black box. As you know, the explainability for the FDA, there's all these requirements that it's going to be really hard to get this stuff approved for medical use if it's not done the right way.
Exactly. Yeah. Okay, I can see a few questions coming in. This is from Kimberly. Kimberly is asking, how are organizations ensuring that they are receiving quality output?
That's a very good question. And that's why I started the conversation with, at the end of the day, for now, because this is still in infancy and obviously it's in beta, we need to have doctors vetting the information, checking the quality. And I think right now it's not ready for the street use in the sense. That's why I think a lot of the governments are jumping in and saying, whoa, our people cannot use this. We need to put safeguards. Doctors in a different box, because I'm responsible for my stethoscope. I'm responsible for books that I read. This is just another form of information. So at the end of the day, I am responsible for using that. And so I hold that differently. So I think that's the quality check, that at the end of the day, it's with doctors.
Mm-hmm. We've got another question. I am not sure if you have answered that. How can public sector make sure data privacy is taken care? Again, something on data privacy.
Yeah, no, I think the best thing for healthcare in a way is we have HIPAA, and in Europe, we have other privacy laws that are, there's huge fines. I know California has their own set of laws that are pretty higher than HIPAA. So there's a lot of things making sure that we use this as a safeguard. My worry, honestly, is the small developer. I'm more worried that the startup that doesn't know, that doesn't pay for a lawyer, that says, oh, we have this API, we're just going to go for it and get information, and not realize that they're actually breaking privacy laws. I'm not worried about OpenAI or the big dogs, because at the end of the day, they have lawyers' money. They're making sure that they don't do anything. If you look at anything medical from ChatGPT, it says, I'm not a doctor, and it's all these disclaimers. But the private, small companies, that's my worry. So.
Got it. So I have one more question, but before I begin that question, the question is totally something against how can humans and AI work together? But there's this study that the Journal of the American Medical Association, JAMA, they call themselves a group of certified healthcare professionals. What they did was they evaluated the responses of both physicians and chatbots to patient inquiries. Those are publicly available on social media forums. Interestingly, what they found out was that the responses given by the chatbots were more empathetic, and they got higher rating than the rating that the doctor got. It's because the doctor is like, he gets a lot of queries, and sometimes he gets frustrated, but the AI does not get frustrated. So bringing this question, the question is here is, so both works well and both needs their own space. How can both AI and human work together? This is a question which I ask at every webinar. How can both AI and webinar work together, especially on healthcare? Where do you see what tasks should go to the AI? What tasks should go to the healthcare or for the doctors?
Yeah. Awesome question. I think for today, in today's age, like I mentioned in the presentation, I think it's better for education on the doctor side. We have to make sure that we're doing things that we can vet and make sure that information is safe. We need to make sure that there's safeguards on making sure what should we do and not. I think personally what's going to happen, and I see this already, is what the AI should do is what the humans don't want to do. So the humans don't want to do repetition. They don't want to document. They don't want to use this keyboard. You as a patient, you don't want me looking away, typing and looking at you once in a while. You want me to look at you. And so the future is going to be where they're using AI and it's already transcribing. At one point, I had over 50 doctors under me, and a lot of them asked me for scribes. Nowadays, if I had that same issue, I wouldn't pay for a scribe. I would just use the AI to transcribe everything. And so my point is that repetition. I feel bad. Some of my older doctors, they would stay 2-3 hours after work or take the work home just to type because they couldn't type fast enough. And so these are the things that I think AI is going to take away: the repetitive nature, the administration part of it that sucks for doctors, and they'll be able to spend more time with their patients. I mean, think about it when you see your doctor, especially a lot of the EMRs in the United States, we're stuck with looking down and typing. Why not do that? So anyway, I think that's the future.
Got it. We've got a lot of questions. I'm going to pick one of them. It's from Dr. Xavier. He's asking what potential educational challenge. Okay,
I check out that one.
If I may ask everyone to please mute themselves.
Sound.
Okay, I have an option to mute. I'm still figuring out. Found it. Yeah. Okay. The question goes, what potential educational challenges could arise as AI becomes more integrated into learning environments, and how can we ensure students still develop critical thinking skills? Okay, this is not very much into,
But but that's a good one. So I see somebody just posted something. So to answer your question is the following. One of the dangers is we're going to have humans are humans. We all make mistakes. We all have biases. And sometimes our biases in our brain, we think they're facts. And so if I am a computer programmer, or if I'm reinforced learning, or if I'm doing this kind of stuff, I am reinforcing bad biases into the algorithm, and then we're using the algorithm to teach our children, and then they're learning the same biases. And so how do we correct that? That's a tough one. I think we need to have more subjectivity, with history, stuff like that. Even that could be faltered. If one country says, no, we didn't start the war, it was that country, that's a bias that's going to be in there. So we need to figure out how to make sure that we still have human reinforced learning. And I don't think it's just one, I think it's together. That's just going to be always a problem. The other part of the question, how do we ensure the students still develop critical thinking? We need to change our educational system. We just can't teach the way we normally do. I know I have 19 years old, and he's wanting to use ChatGPT, and I'm always teaching him stuff, but then he always wants to do that for his homework, and I'm having to teach him how to use his brain, how to do his critical thinking. And so I think instead of having papers due, they need to have those papers due in class, where they're like, okay, here's the paper. Okay, now you're going to present and tell me why you came to that conclusion. That way they're really using critical thinking. So I think that's going to be the future.
Okay, so this is a question from my end. Can you share any success stories that you have seen in the industry where doctors or healthcare companies are using ChatGPT, which you have seen like a major impact, which has really turned around their life right at the moment? Yeah,
I have talked with different companies that are using ChatGPT to help them with their summarizations and the EMRs and using that type of technology. And I think it's helping them in the sense that it's making them more efficient. Instead of spending, 15 minutes on doing documentation, it's maybe cutting it down to 6 minutes. And so that change is huge, and it's helping patients right away and the doctor, because now the doctor doesn't have to worry about all this admin stuff. So yeah, that's some examples. And like I mentioned earlier, that example of the discharge instruction, this hospital using it to give better discharge instructions.
Definitely. One interesting question from Kimberly is, do you see prompt engineering as becoming a class taught in high school and medical students?
That's an interesting one. Yes, I see that as a tool, but honestly, it's how do I say it? I think with time, that's going to go away, in the sense that these algorithms are getting so strong that yes, you can learn the basics, but I think eventually it's going to be more of a conversation, and it just may take you a little longer to get there, but I think that's going to go away. Plus, right now you can see that there's plugins that say, hey, better prompt. And so you can ask if you don't know what to ask, you can have a plugin to help you know how to ask. But yeah, just another aside one. Sometimes when I do art and I use text to print or texting to, create an image, I'll ask ChatGPT, hey, help me create this image and tell me what are the best ways to ask so that I can put it into, DALL-E or one of these so that it can tell me how to do the prompt. But that's a good question. But yeah, I think eventually it's going to be taught, but I think it's going to go away because it's just going to continue to advance.
Yeah, I think even if doctors learn using ChatGPT or this LLM models, the whole hospital as a whole has to transform with it. Like if I as a doctor starts taking in notes with the help of AI, these notes should go into a system and gets recorded. So if you're a brick and mortar like old school hospital, you have to transform or digitize your whole hospital into it. Not sure if I'm making a point over there. It's just something that just came over my head.
Sure.
Cool. So any best practices for the doctors joining here on the call? Do you want to give any best practices before using ChatGPT for them?
Yeah, no, overall, the main thing to remember is this is still a beta. The fact that ChatGPT let us play with this early, it's still in infancy. So my best advice is even when ChatGPT, if you ask it to give you a reference, always check everything, verify even the references, because honestly, there's reports that show that, let's say I asked it about heart failure and I say, hey, give me an article, and they gave me an article. Sometimes the author doesn't match the article or the art itself, or the article has nothing to do with heart failure. So make sure, my best advice is to verify everything. I think it's a fun toy to play with, and I call it a toy, but at the same time, I think it has a potential. And again, you said it great. It's going to be the human plus the AI that is going to give you more than just the human or just the AI. And it's a combination of using both. I think as a doctor, I know how to speak the doctor language. So when I put it into ChatGPT, I'm able to get great output. But it's someone that may not be a doctor that puts it in may not get that same output. And that's where the prompt engineering comes in. Also, the other famous thing that everybody talks about is garbage in, garbage out. This training data, if it's specialized, let's say there's all this research on breast cancer here in the United States, does that information apply outside of the United States? Maybe, maybe not. Maybe it's a different population, maybe a different age group, like a whole bunch of other stuff. So be careful is what I would say. We need the guardrails, but big picture, keep an eye out on Hippocratic AI, Glass Health AI, other large language models that are very specific to healthcare. I think that's going to be better.
Got it. I'm reading out a question from one of our attendees. That is, what is your take on the total ban of AI in crucial areas like healthcare as being propagated by some big skeptics? Is it even practical now, or even counterproductive once the cat is out of the box? What is your message to them? That person has also shared an article with us, which is from AI Magazine.
Love it. I think the cat's out of the bag. Just like Google, when I was going through medical school, patients would come with Google paperwork, and the doctors would hate it because I was still in medical school training, and they'd be like, I hate Dr. Google. Same thing's going to happen. People are still going to use ChatGPT or the next GPT, which reminds me, one of my biggest worries is I think as doctors, we need to make sure we're advocates to explain how not to use ChatGPT and the dangers of it. I'm not worried about doctors making mistakes, because doctors should know based on their training if this information is right or wrong. And I would hope no doctor out there just takes anything and says, oh yeah, that's right, and not even look at it. With patients, I'm more worried that what if the trauma, the emotion, they're like, ChatGPT told me I had cancer, or ChatGPT told me this, I got to go take this medicine, and they go to the pharmacy outside the United States, they can get medicine, and then they take it and they hurt themselves or die. So I'm more worried about people practicing medicine that don't have all the facts. And so, yeah, to answer your question, the cat's out of the bag. This is going to happen. What's interesting to me, and I kind of alluded to it, is there's all these ethical issues going on. So I feel like, from some extent, some companies eventually are not going to want to see this technology make things cheaper. They're going to want to make sure that this thing stays expensive and it keeps prices high. So it'll be very interesting to see what happens in the future.
That's a great take, I guess. Yeah, companies would want to sell it at a higher price. Great technology. Okay, those were all the questions for my end. The audience, if you guys have any question, you can turn on your mic, or you could put on your questions on the comment section for Harvey.
Cool. And you're welcome to upload my my cheat sheet, or come to my LinkedIn if you want to put it on here.
Mm-hmm.
You're welcome
I
to
have
put
it
it
on my
on there.
email address. Let me try to download it.
Yeah. Let's see if I see any other questions. Let's see. Yeah, please ask any other questions. We're going through all of them. And that's why I kind of rushed through my presentation. I wanted to make sure we had time. But big picture, I think we have something I think we're gonna all benefit from. I think my goal is, at the end of the day, is obviously I don't work for ChatGPT. I'm honestly doing this as a public service announcement, like to help people. The books behind me, it's not like a big thing. It's just for me to help. It's more me wanting to see us use AI, hopefully decrease the price of healthcare, hopefully get better outcomes for our patients. Hopefully doctors are not burning out from being in the trenches, but now they're having more fun and giving all the stuff that sucks about being a doctor to AI ideally. And so it'll be pretty cool. And thanks, I see you posted. So thanks for posting that. Feel free to download it, use it. It took me a while to do that. It's pretty fun in the sense that it's got a lot of different things in there. And it's hard to write these cheat sheets because some people are really advanced, some are really basic. And so I try my best to include it all. So I really appreciate the feedback, everybody, and the thumbs up and all that stuff that I see here in the comments.
Okay, we've got one question from Maria. She's asking, as a product manager, how can I leverage ChatGPT for IVF, gynecology, and obstetrics to build and scale as a specialty?
Yeah. So Maria, great question. Right off the cuff, I love marketing, by the way, and I've had over 30 companies. So I love startups. I love creating stuff. So I would leverage the following. Number one, God, my brain's going everywhere. On the marketing side, you can optimize all your website for the best SEO, the best words. I would change my discharge instructions. I would take things to another level. Now you can use VR, you can create stuff on your own, but outside of that, you can still use ChatGPT. You can still use basic stuff like Midjourney allows you to create images and use them for commercial use. Whereas Bing Create and Dolly, I think Dolly does if you use the API, you got to double check that. But the bottom line is I would beef up my website. I would increase SEO. I would work on my blogs. I would work on information, websites, everything around it. So that way you're beating everybody around you. And then it's all about that personal touch. I would make sure that depending how big your practice is, I would make sure that I would feature you as a human being. So I would make sure I would be on the social media. And then you got to figure out what your age group is. So, IVF and gynecology, you're not looking for people that are retired. You're probably looking for that age that's maybe 20 to like 40 range ish. And so you're more likely to start looking at Facebook, Instagram, maybe Instagram over Facebook because of that age population, maybe some TikToks. And so that's how I would leverage this information. This sounds crazy, but there is a plugin on ChatGPT that you can say, hey, give me a script for IVF. Let's make it fun. And it'll find video and it'll actually make the entire video with the script, and it'll do it all on your home computer. And you could probably do it in about 5 minutes, which is crazy. So I would do those kind of things.
Great. So Harvey, you showed one of your last slides had VR. How do you see VR with AI coming in and doing stuff in healthcare?
Yeah. So no one really talks about it. And actually I have a book on AI and VR that I did with the futurists in Europe. But basically I see the following: AI feeding the information to the VR, and then the VR creating it. We're not far from us texting and creating videos. And so we are getting very close to the point where with a little finesse, you can create your own videos just with typing. So fast forward, I really don't think it's going to be like a decade. I think I'm going to fair and say in the next 2 years for sure, we'll have the technology where Maria here could create IVF videos, type them in. And so when she has a patient, she can have her patients put on the VR and then they can see how IVF happens, but in 3D. And then also with AR. And so then the AI is feeding into the glasses, creating the images, and then you're able to see it in real time and you can customize it to your brand, to your liking, to that person. And that's how AI would be feeding into AR or VR. It's going to be amazing. I can't wait.
Great. Yeah, these are going to be revolutionary. Not sure. Um, okay. So what I've done is I've put on your LinkedIn profile on the chat. I would request every audience to go and check out Harvey's LinkedIn, connect with him. He shares trending topics on healthcare and ChatGPT. Very informative. Uh, okay, last call out for any questions for Harvey. Feel free to
Yeah, I
turn
just
on
want to
the
say
mic.
thank you so much for having me. And like I said, we'll do it again. And honor to be here. And I'm working on a AI and healthcare course. Literally, I've been working my butt off on this thing. So my goal is to have it out probably by August 15 is my personal date. I have about 55 videos that I want to do on my own that are around 55 lectures that I have for this AI and healthcare. So feel free to follow me. And then if you want to check out the course, I should have it out here in about 2 weeks.
Yeah, so one thing which happened was while I was promoting your webinar to other people, reaching out to them on LinkedIn, they've asked me like, is there a certification that I can do which certifies me that I'm a healthcare professional, but I'm also very proficient in LLMs or like ChatGPT? Is that so? Your course does help with that?
That's a good question. There are some companies out there. I want to say, uh, gosh, I'm going blank right now, but yeah, Dr. Anthony Chang has his own one. It's about $600 for doctors, and I think non-doctors is 300. And he has his own certification program. I'm gonna have a certificate from the company, but it's not anything as official as his. But even his is not as official. But I think at the end of the day, it's just showing that you have the knowledge. I was thinking about it. I think I'm going to try to create my course so that way it's got like a pre-course before you go to his. I've taken his and it's so advanced that even his basic one I thought was not basic in my mind. So, but as I start creating this information, it's really tough to teach large language model to a doctor and not go into all the weeds of all of it. So, but yeah, good question. And I would say, for now, there's no residency out there, but I know I've heard different companies talk about they want to put this in the med school and create an actual actual fellowship and all this stuff for it. And I think that day is coming. The beauty is this: if you're a doctor and you get AI background, only a handful of doctors have that knowledge, and so you'll be a commodity. And so, yes, it'd be nice to have it, but at the same time, just understanding and going through it and having that knowledge is huge. And I think most hospitals will appreciate you having that background.
Great. We've got a few comments from Dr. Avnish Khare. He says, if you can get the job done, that is a certificate. You don't need a certificate. And he believes that future is a permissionless economy. Okay. Even I believe
Like it.
someone put there. Yeah. Even I believe in.
Awesome. Thank you, doctor.
Cool.
Yeah.
I think we are good at time. Harvey, I would really like to thank you, like from the deep of my heart, taking out the time and doing this with us. It's really appreciated. People, please check out, connect with Harvey on LinkedIn, stay connected with him.
Yeah, and honestly, it was an honor both ways. It was an honor to be here. I love doing this stuff. I love helping. I love teaching. And I hope we can do this again. And then follow me. And I just thought of this. I'm just dropping my Amazon link if you want to go through. Since we have one more minute, I'll just say this real fast. Fox News called me because I just decided to write a book on cold cases, on how to solve crime and using AI. And I looked at the principles of AI and said, you would have caught this person, Jeffrey Dahmer, or all these famous people had you had AI back then. And I explained how you could do it. And so my point is this: as humans, we all have our creativity. Don't worry so much that ChatGPT is going to take your job. Think more of use your creativity, use AI, put it together and create something new. And that's kind of what I did with these books. So I want to motivate everybody to do the best they can. And good luck, everyone. And thank you.
Thank you so much, Harvey. Thank you so much. Thank you, everyone, for joining us today.
Bye.